Hey everyone, this is Anna here with Radar Opus. I just wanted to go over Farokh Master's book, Clinical Observations of Children's Remedies. It is a very valuable reference, and I've actually used it on a number of my pediatric patients to help me find the case. So I just wanted to go over how you use it so that you can find value if you do have it, or if you're interested in buying it, you know what you would be buying. So I'm in my Radar Opus program, and I'm just going to go over to references, and I'll just start typing in Farokh. Okay, let's do Master Farokh. Okay, and here we have Clinical Observations of Children's Remedies. So I'm going to just click that once, and now I have that open. So a really cool feature about Radar Opus is that you can search within the document. I use the search function all the time on every patient, multiple times a day. So you can just hit Control F and search a particular word or something that you're interested in. Let's just say you're really interested to see what, if the remedy Ferrum metallicum comes up. You can search that really easily. So I just want to give an overview of this reference and kind of what's included in it. So there is an introduction section. There's a whole section on abnormal behavior, which is really nice. He kind of goes through, what you would see in ADHD or, any sorts of speech problems, temper tantrums, anything that would be abnormal that you would want to note, especially if you don't see pediatrics. It's nice to have a reference to tell you, what's normal and what's not. He also has, I really like, where is it? Observation of newborns, infants, and toddlers. I find this to be pretty helpful. It gives you a really nice overview, again, of what's normal, or if you have something that's abnormal, where you can find it. So if a newborn prefers the right breast over the left breast when they're breastfeeding, he tells you that the rubrics, right-sided or left-sided complaint should be considered. So lots of observations, for example, calcarean lycopodium will cry when lifted from the cradle. If that was happening to your patient, you could have Controlled F, and searched for the word lift, and that would hopefully come up and show you cry when lifted from the cradle. Although it's not showing me any results, which is kind of weird. So I want to show you what remedies are included in this reference. So if we go to our binoculars here, we can see there are many, many remedies included. Let's just go into, let's just say hyoscyamus, for example. I'm just going to click enter. I have, basically a really nice synopsis of what I would see for a child that needs hyoscyamus, what they would have in their mind, their physical ailments, other important symptoms. So you can definitely read about each remedy and get a really thorough look at what this would look like in a child. I really like this reference section, especially for children, because I feel like it's so detailed and there's so many remedies that, that are included in this reference. Some references only have like 8 to 10 of the top, children's remedies, but I really like that this has more than just the polycrust remedies, because I find myself using more than just the polycross remedies when I'm prescribing for my patients. Another really nice feature, let's say that you wanted to advance search. And let's say that a patient comes to you and, you know, they have a lot of gingivitis and they have a lot of bleeding with their gingivitis. So they have really inflamed gums and you want to try to find that. What you can do is you can go to advanced search. So I already have this reference open, as you can see. Let's say I didn't have it open. What I would do is I'd go over to references and again type in master and then click it open. And I'm going to search for bleed and then gingivitis. I could either do one or the other. I'm going to make sure that all of my words are in the same paragraph. And here, I'm going to search my current document because what my current document is the Master Farokh Master's clinical observations of children's remedies. So I'm just going to click that. So I'm looking for everywhere in that book where bleeding gingivitis comes up. And I can see here, Arania ixabola, I think that's a spider, has bleeding gingivitis. If I scroll down, Ora metallicum also has dark red gums which bleed easily, gingivitis. And carcinosin also has gingivitis with swelling and bleeding. So here I've really narrowed it down. If this is an important symptom, these are 3 really good remedies that I should consider. If I want to go into, let's say I want to read more about this remedy, all I simply do is just double click and it will bring me right to that line that I'm interested in. And so I can read more about the remedy now and see if this fits my patient and what's going on with them. So, you know, in synopsis, this is a very, very handy reference to have, especially if you see pediatric patients. You know, if you see them every day, I would say definitely have this reference. If you see them once in a while, I'd also suggest having this. It gives a really good overview of, you know, many remedies and also a really nice background as to what you're looking for in a pediatric patient. So that was just a really quick overview. I'm trying to think if there's anything else I'd like to tell you guys. I did see some graphs in this reference. I'm not sure what remedy it was under. I sometimes get in rabbit holes of looking at all of this information. It's really fun, but yeah, there's just a bunch of really nice remedies to see, and it's cool to see how these present in pediatrics. That's something that I'm really interested in. So I hope you guys found this useful, and if you have any questions, you can always reach out to training@radaropus.us. That's the email that I check, and I'm happy to answer any questions. Thank you guys so much. Have a good day.